If your doctor told you to stop eating after 7 p.m. to manage your morning blood sugar, I need to share something that may surprise you about that recommendation. A 2023 study published in the Journal of Clinical Endocrinology and Metabolism involving 147 adults over 60 with type 2 diabetes revealed something many healthcare providers still haven't fully recognized. The right beverage before bedtime doesn't increase fasting glucose, it reduces it. And some of the drinks people switch to believing they are healthier. Herbal infusions with hidden sweeteners, commercially prepared diabetic-friendly shakes, and even certain sugar-free nighttime drinks are silently raising blood sugar levels during sleep while damaging the restorative rest your body urgently needs after age 60. Today, I'm sharing 5 bedtime beverages that clinical evidence suggests can reduce morning glucose by 10 to 30 milligrams per deciliter. And I'm also warning you about 3 that may already be sitting in your kitchen and quietly ruining your results. Pay special attention to number 2 on the beneficial list. It costs about 40 cents per serving and may work more effectively than many sleep medications. And number 1 on the warning list could surprise you because it's specifically promoted to people with diabetes. Before we continue, tell me this. What's your typical fasting blood sugar when you wake up? Leave the number in the comments. And if this information helps you, subscribe to the channel. Think of it as having access to a specialist whenever you need guidance. Now let me walk you through the science that can completely transform your nighttime routine. Here's what takes place in your body between 10 p.m. and 6 a.m. that very few adults over 60 understand. And it's the reason the right bedtime drink can be more important than anything you had for dinner. While you sleep, your liver should remain relatively inactive. But with type 2 diabetes, especially after age 60, your liver often doesn't receive that signal. Around 3 a.m., it begins releasing stored glucose into the bloodstream through a mechanism known as gluconeogenesis. That's why you can go to bed at 110 milligrams per deciliter and wake up at 145 despite not eating anything at all. Your liver launched a sugar release while you were asleep. The 5 beverages I'm about to discuss target what I call the 3 nighttime regulators. Regulator number 1, they reduce that 3 a.m. liver glucose release by enhancing insulin sensitivity during sleep. Regulator number 2, they stimulate incretin hormones, the same hormones medications like Ozempic are designed to mimic, preparing your pancreas for morning glucose regulation. And regulator number 3, they enhance sleep quality. Better sleep lowers cortisol. Lower cortisol means reduced glucose resistance the following morning. The 2023 study I referenced earlier, conducted by Dr. Zhao and colleagues, monitored participants for 12 weeks. Those who consumed specific nutrient-timed drinks before bedtime experienced an average fasting glucose reduction of 23 milligrams per deciliter. The comparison group that drank nothing experienced no meaningful improvement. That's almost a half-point reduction in HbA1c from a single evening habit. Let's begin with the most effective option. I encourage you to try this one first, especially if you wake up several times each night to use the restroom, because this drink provides 2 important benefits. Unsweetened almond milk contains only 1 to 2 grams of carbohydrates per cup. Compare that with regular milk, which contains about 12 grams, and you're already at an advantage. But here's where it gets interesting. Almonds are naturally rich in magnesium, providing roughly 75 milligrams per cup of almond milk. Magnesium is one of the most overlooked nutrients for blood sugar management after age 60. A 2022 meta-analysis published in Diabetes Care evaluated 18 studies and found that magnesium supplementation improved fasting glucose and insulin sensitivity, particularly among older adults who are frequently deficient. After age 60, your kidneys don't retain magnesium as efficiently as they once did. More is lost through urine, and insufficient magnesium makes every cell in your body less responsive to insulin. Now add half a teaspoon of authentic Ceylon cinnamon, not the inexpensive cassia cinnamon commonly found in most supermarkets. Ceylon cinnamon contains active compounds known as cinnamaldehyde and procyanidins. These compounds stimulate insulin receptors and improve how effectively GLUT4 transporters move glucose from the bloodstream into cells. Research published in the Annals of Family Medicine demonstrated that just 1 gram of cinnamon daily reduced fasting glucose by an average of 18 milligrams per deciliter over a 12-week period. Here's the recipe: 1 cup of unsweetened almond milk, heated but not boiling. Add half a teaspoon of Ceylon cinnamon, and if you'd like a little sweetness, mix in 1/4 teaspoon of vanilla extract. Consume it 30 to 60 minutes before bedtime. Total cost? Approximately 35 cents per serving. It's less expensive than almost every supplement in your medicine cabinet. One important note: if you're taking blood pressure medications, particularly calcium channel blockers, magnesium may amplify their effects. Begin with half a cup and pay attention to how you feel. Always consult your healthcare provider before making this part of your nightly routine. I know what you're probably thinking. Apple cider vinegar before bed? Won't that irritate my stomach? That's exactly why we're combining it with chamomile. Let me explain. Chamomile has been used as a natural sleep remedy for generations, but only recently have researchers understood why it may be especially useful for people with diabetes. A 2023 study published in Nutrition Journal followed 64 adults with type 2 diabetes who consumed chamomile tea 3 times daily for 8 weeks. Their HbA1c decreased by an average of 0.52%, and their fasting glucose levels improved significantly. Researchers attributed these benefits to apigenin, a compound in chamomile that interacts with GABA receptors in the brain while also improving cellular insulin responsiveness. Now add 1 tablespoon of raw, unfiltered apple cider vinegar. A well-known study from Arizona State University found that consuming vinegar before bedtime lowered next morning fasting glucose by approximately 4% to 6% in individuals with type 2 diabetes. The acetic acid found in vinegar slows the conversion of glycogen into glucose within the liver. In other words, it helps reduce that 3 a.m. glucose release I mentioned earlier. But here's why chamomile is important. Drinking apple cider vinegar on an empty stomach can trigger acid reflux, especially in adults over 60 whose lower esophageal sphincter may no longer function as effectively as it once did. Chamomile acts as a natural soothing anti-inflammatory and helps protect the stomach lining. Together, they complement each other perfectly. Here's how to prepare it. Brew 1 cup of chamomile tea and allow it to cool until warm rather than hot. Then mix in 1 tablespoon of apple cider vinegar containing the mother. Drink it about 45 minutes before bed. If the flavor is too strong, add a few drops of liquid stevia. Let me tell you about Margaret. She's 67, came to my practice with a fasting glucose hovering around 152 despite taking metformin. I suggested this exact drink. 6 weeks later, her fasting glucose averaged 126. She said the first 3 nights she hated the taste, but by week 2, she started looking forward to it as part of her wind-down routine. This one surprises people, but it's one of the most underrated blood sugar tools I know, and it's especially powerful if you also struggle with joint pain or poor wound healing. Real bone broth, the kind simmered for 12 to 24 hours, is rich in glycine, an amino acid that has been shown in clinical trials to improve insulin secretion and reduce inflammation. A 2023 study in the American Journal of Clinical Nutrition found that glycine supplementation before bed improved fasting glucose and reduced oxidative stress markers in older adults with metabolic syndrome. But here's what almost nobody talks about. Glycine also improves sleep quality by lowering your core body temperature, which is one of the signals your brain needs to enter deep sleep. And deep sleep is when your body repairs insulin receptors and clears glucose most efficiently. The pinch of sea salt is not optional. After 60, your body's thirst signals weaken. You become mildly dehydrated overnight without realizing it. Dehydration concentrates the glucose in your bloodstream, making your morning number falsely elevated. A small pinch of mineral-rich sea salt helps your cells hold on to hydration while you sleep. Here's what you need: 8 ounces of true bone broth, not boxed stock from the store. Look for brands like Kettle and Fire, Bonafide Provisions, or make your own from chicken or beef bones. Warm it gently on the stove, add a pinch of sea salt and a crack of black pepper to improve absorption. Drink it 30 to 45 minutes before bed. Calories per serving, about 40. Carbs, less than 1 gram. Protein, 9 to 10 grams. That protein triggers a mild release of glucagon-like peptide 1, or GLP-1, the same hormone that keeps your liver in check overnight. One warning: if you have kidney disease or you've been told to limit protein, talk to your doctor first. But for most people over 60, this is one of the gentlest, most nourishing things you can give your body before sleep. This is the 40-cent drink I teased at the beginning, and if you've been relying on melatonin supplements to sleep, I need you to pay very close attention. Tart cherry juice is one of the only natural food sources of melatonin, the hormone that regulates your sleep-wake cycle. A study from Louisiana State University found that drinking tart cherry juice twice a day increased sleep time by an average of 84 minutes in older adults with insomnia. But here's the part that matters for your blood sugar. Tart cherries have a glycemic index of only 54, far lower than sweet cherries at 72. And they're loaded with anthocyanins, the deep red pigments that have been shown to improve insulin sensitivity and reduce inflammation in pancreatic beta cells, the cells that produce insulin. A 2023 clinical trial published in Nutrients followed 37 adults with metabolic syndrome who consumed tart cherry juice daily. After 12 weeks, their fasting insulin dropped significantly, and their HOMA-IR, a measure of insulin resistance, improved by nearly 20%. But you cannot drink it straight. Pure tart cherry juice, even unsweetened, contains about 25 grams of natural sugar per cup. That's too much before bed. Here's the ratio. 2 tablespoons of 100% tart cherry juice diluted in 8 ounces of cold or room temperature water. That brings your total carbs down to about 6 grams, which is safe for most diabetics, while still giving you enough anthocyanins and melatonin to do the job. Brands I trust: Cherubundi, Dynamic Health, Lakewood Organic. Cost per serving when diluted properly, about 40 cents. Compare that to melatonin supplements at $8 to $12 per bottle, and you're getting better sleep and better glucose control for a fraction of the price. Quick check-in. Have you ever tried tart cherry juice? Did you notice any change in your sleep or your morning glucose? Type it in the comments. Other people watching this need to hear your real experience. And stay with me because number 1, the most powerful drink on this list is something you've probably never heard of, and it works on a mechanism that no other beverage touches. This is the drink I save for my patients whose fasting glucose is stuck above 140 no matter what they do, and the science behind it is genuinely remarkable. Fenugreek seeds contain a unique soluble fiber called galactomannan. When you steep the seeds in hot water, this fiber dissolves and forms a gel-like substance in your stomach and intestines. That gel slows the breakdown of carbohydrates from your dinner and delays glucose absorption for hours well into the night. But here's the breakthrough. A 2024 meta-analysis published in Frontiers in Pharmacology reviewed 12 randomized controlled trials involving over 600 diabetic patients. Fenugreek supplementation lowered fasting blood glucose by an average of 28 milligrams per deciliter. That's more than some prescription medications, and there's a secondary benefit almost no one talks about. Fenugreek contains 4-hydroxyisoleucine, an amino acid that directly stimulates insulin secretion, but only in the presence of glucose. That means it won't cause hypoglycemia in the middle of the night. It's smart. It works when you need it and stays quiet when you don't. Here's how to make it. 1 teaspoon of fenugreek seeds available at any Indian grocery store or online for about $4 per pound. Add the seeds to 8 ounces of boiling water, steep for 10 full minutes. Strain out the seeds. Drink it warm 30 to 60 minutes before bed. You can add a squeeze of lemon or a drop of stevia if the taste is too bitter at first. Let me tell you about Robert, 72 years old, fasting glucose consistently between 155 and 160. He started drinking fenugreek tea every night. 8 weeks later, his average fasting glucose was 129. He told me he could barely believe his meter the first time he saw a number starting with 1 instead of 1.5. One important caution: fenugreek can interact with blood thinners like warfarin, and if you're on insulin, it may enhance the effect. So, monitor your glucose closely and adjust with your doctor's guidance. Some people also notice a maple syrup smell in their sweat after a week or two. That's harmless, just a quirk of how your body metabolizes the seeds. Now you have 5 drinks to help reset your overnight glucose. But before you go to the kitchen tonight, I need to warn you about 3 beverages that are marketed as safe or even healthy for bedtime. And one of them is in almost every diabetic household in America. I know, herbal tea sounds innocent. No caffeine, no sugar on the label, just a soothing cup before bed. But read the ingredient list carefully. Many popular bedtime teas, especially the ones in grocery store brands, contain natural flavors. That phrase is a loophole. Natural flavors can legally include sweeteners, sugar alcohols, and even small amounts of fruit concentrate. And those small amounts add up. A study from the Center for Science in the Public Interest found that some flavor teas contain up to 4 grams of hidden carbohydrates per serving that don't appear in the nutrition panel because of rounding rules. 4 grams might not sound like much, but right before bed, when your metabolism is slowest, that's enough to prevent your body from entering the fasted state it needs for overnight glucose control. Brands to be cautious with: Celestial Seasonings, Sugar Cookie, Sleepy Time, Bigelow Vanilla Chai, Yogi Bedtime. Check every ingredient. If you see natural flavors in the top 5 ingredients, skip it. Golden milk has become incredibly trendy, and turmeric absolutely has anti-inflammatory benefits, but the pre-made versions sold at Trader Joe's, Whole Foods, and Starbucks are sugar bombs in disguise. A 12-ounce serving of commercial golden milk contains anywhere from 16 to 24 grams of sugar, often from coconut sugar, date syrup, or agave, which manufacturers call natural sweeteners. But your pancreas doesn't care if the sugar came from a date or a donut. It's still glucose flooding your bloodstream right before you lie down for 8 hours. If you want golden milk, make it at home. Unsweetened almond milk, half a teaspoon of turmeric, a pinch of black pepper to activate the curcumin, and a drop of stevia. That's safe. The bottled version at the coffee shop is not. This is the one that makes me angriest because it's predatory marketing aimed directly at people trying to do the right thing. Glucerna, the shake made by Abbott specifically for diabetics, contains 23 grams of carbohydrates per bottle. Boost Glucose Control has 25 grams. And here's the cruelest part. They contain maltodextrin, a fast-digesting carbohydrate with a glycemic index between 85 and 105, higher than table sugar. The claim on the label says it is designed to minimize blood sugar spikes. What they mean is the added fiber slows it slightly, but slightly is not the same as safe. A 2022 review in Diabetes Therapy found that many diabetic-specific nutritional shakes caused postprandial glucose spikes of 40 to 60 milligrams per deciliter, especially when consumed without food. And before bed, that spike happens while you sleep, triggering an insulin surge, disrupting your sleep architecture, and setting you up for a higher fasting glucose in the morning. It's the exact opposite of what you need. If you need a bedtime snack because of nighttime hypoglycemia, have 10 almonds and a piece of cheese. Real food, predictable, no marketing lies. Let me pull this all together into a simple system you can start tonight. Step 1. Choose one of the 5 drinks I gave you and commit to it for 2 weeks. Consistency is everything. Your body needs time to respond. Step 2. Timing matters. Drink it 30 to 60 minutes before you lie down. Not right before bed, not with dinner. The window matters. Step 3. Check your fasting glucose every morning and write it down. Track the trend over 14 days. That's your real data. Your meter is smarter than any article. Step 4. Clear out your pantry tonight. If you have flavored teas with natural flavors, golden milk in a carton, or glucerna in the fridge, throw them out. You now know better. Of the 5 drinks I shared today, which one are you going to try tonight? Type the name in the comments. And if there's someone you love who's frustrated by high morning blood sugar despite doing everything right, send them this video. They deserve to know what actually works. I'm Dr. Sarah Miller, and I want to see you wake up with energy, clarity, and numbers you can be proud of. This video is for education only. Do not adjust your insulin, metformin, or any diabetes medication based on what I've shared. Any change to your prescriptions must go through your doctor. Sleep well, and I'll see you in the next one. Subscribe and stay close.